two, one. Please start, sir. We are live.
Okay. Good evening, friends. As in the some of the previous meetings, we had discussed with a disease called diabetes, which we generally call raised sugar, which is basically a long-term disease, a lifelong, in fact. And one need to cope up with this disease because it is going to stay there for rest of our life, if unfortunately some of us get it. So we want to discuss how we can feel more comfortable, little more happy while having this disease with us. Next, please. Yeah. So as we all know that the diabetes is associated with a lot of complex social, behavioral, emotional, as well as environmental factors. And well-being of a person living with diabetes and their outcome actually depends on how we deal with this. If left unattended, psychosocial issues, apart from the medical management of the disease, can negatively impact the well-being as well as the social life of the individual with this disease, that is diabetes. Next, please. So we should try and address the psychological issues which can actually help overcoming the barriers associated with management of diabetes, including adherence to the drug treatment, self-care measures, we will come to it little later, and the overall management of diabetes, in fact. So the psychological aspect of the disease is so important because it is going to be there for rest of our life. So psychological aspect, taking care of them, is extremely important. Next, please. Yeah, the common burden associated with diabetes is one of the important problem we face with our patients is the diabetes related distress. Patient is actually extremely uncomfortable when somebody is diagnosed to have diabetes. He or she knows that it is going to be there and maybe some sort of complications little later in part of the disease. So diabetes distress is actually an emotional response characterized by extreme apprehension, discomfort, dejection due to perceived inability to cope up with the challenges and demands of living with diabetes disease. So this kind of distress puts the patient into a lot of stress as we diagnose them to have diabetes. Next, please. So several studies have been conducted across India as well as abroad have reported high prevalence of diabetes related distress as well as depression, frankly, in people who are having diabetes. So this aspect of the disease is actually often missed by many of us sometimes, including the clinicians and physicians. So good number of people will have almost 20 to 40% will have some sort of psychological stress, distress with the when they were diagnosed to have diabetes, as well as some of them would have frank depression, so which may require a psychiatrist intervention or a psychologist intervention at times. Next, please. Yeah, some of the identifiable periods when we can have more sort of diabetes related distress and where the diabetes distress is likely to be more common and more prominent, it is at the time of diagnosis of diabetes and at the time when we are trying to learn how to self manage the diabetes. That means looking at our sugar levels, then sometimes modifying the doses of drugs as well as insulin, sometimes by the patient himself once they have been adequately educated about that. At the emergence of complication after a few years, maybe at least 10 years or more after the diabetes was diagnosed, many of them will develop a lot of complication, including nerve related problem, that is neuropathy. Eyes, may we will have a lot of retinal involvement because of this, and the kidney involvement in the form of diabetic nephropathy. So this is another time where the stress level or the distress levels is likely to be very high in these patients, and also at the time of switching the patients, especially from the oral to the injectables, that is insulin. Next, please. So these are four periods where we need to focus more on the stress or the psychological aspect of the person. So we should continue or we should be vigilant as a physician or as a diabetes care provider about the screening of the diabetes distress. So, next, please. To find out that what is the kind of degree of diabetes distress, we can put these questionnaire to the patients. I will probably, for the sake of the time, not go into the details of all these things. And then we assess that how much is the score of our patient. If it is very much bothersome, a particular question, it is graded as 6. If it is mild or no significant problem, it is graded as 1. So this can help us to analyze whether the patient is having distress, or and then if it is there, in what degree of distress he or she is likely to be having. Next, please. So there are a lot of challenges we would face in this kind of a lifelong or a long-term disease. This may be related to the treatment itself, that frequent monitoring of sugars are required, modifying the doses of drugs, insulin, and repeated healthcare visits at the times. And of course, it puts them onto the economic burden to the patient. And then lifestyle modifications are generally required, including dietary. Somebody was very fond of sweets, he will not have to take them. He was interested in kind of sedentary life, so he will have to increase the physical activity significantly. And then the once the complications like nephropathy, retinopathy things sets up, it further increases the cost, and it becomes kind of a multidisciplinary care, including care of diabetic foot or eye disease as well as neuropathy. Some of them will go on to have amputation of the limbs, unfortunately, sometimes. So it becomes a multidisciplinary kind of care. And then the cost of course goes up every time once we get a new complication. And then the today's focus or the topic of discussion, that is the psychosocial social abnormalities in these patients. They may have a lot of eating disorders, body image issues, because a lot of dietary restrictions are put into there. Then there are a lot of psychological or psychosocial issues in these patients. Next, please. Yeah. Diabetes care actually should encompass the amelioration of physical symptoms, of course, because patient is interested that my symptoms should resolve. Reduction of the risk of complication. We should try and intervene early so that the future complications like kidney failure, eye involvement, as well as the neural involvement can be prevented or at least delayed. And overall feeling of well-being should be promoted in these patients. So it is kind of a long-term disease, we all know that, and we need to start our work as early as possible, to the extent that there is a concept called metabolic memory, or the metabolic legacy. That means if we do not control the sugar in the initial part of the onset of the disease, then the long-term complications are likely to be there. They are more likely to be there as compared to when the initial 5 years were extremely well controlled. So we need to work fast, we need to work rapidly and strongly. So we need to bring down the sugar levels near normal as early as possible. Next, please. Yeah, there are multiple stakeholders into this managing this diabetes and diabetes related problems. The many people would contribute to this so-called happiness or the avoiding distress or stress to these patients with diabetes. One is the person himself who is having diabetes. Then the caregivers, it could be nurses, it could be physicians, it could be counselors or educators, which will all come together and help the person or the individual to remain happy or the socially active and leading a fruitful life along with the diabetes. So the various factors with each of these stakeholders may influence positively or negatively. If you work very well, it will have a positive impact on the patient. It may have a negative impact sometimes if the caregiving was not as good. So this will all contribute or will be responsible for the degree of glycemic happiness. Glycemic happiness is basically level of happiness we are having when we are suffering from diabetes. Next, please. So it is a multifactorial kind of issue. So we will have to focus on various aspects of it. What is glycemic happiness? It is a concept that helps people living with diabetes to lead a productive, fulfilling life without being overwhelmed with the diabetes. Now I am having diabetes, so my life is almost gone. It is not like that. So one need to manage the diabetes medically, look into the psychological issues of the person, and then so that the person could have a productive and fulfilling life. Glycemic happiness is actually defined as a state of emotional and biomedical well-being in persons with diabetes mellitus. So the emotional stability or the happiness is something which is extremely important, which is sometimes I would say lacking in routine care of the diabetic patients. Next, please. So the overall awareness is extremely important. Patient need to take part actively in the management of his diabetes apart from his diabetes care team. It is an so what are the new target for diabetes care? We all know that this is a average for 2 to 3 months. Sugar HbA1c should be preferably less than 7%. Preprandial before meal glucose should be kept between 80 to 130 milligram per deciliter. Post meal 1.5 to 2 hours later should be less than 180 milligram per deciliter. And of course, we would want that a patient is having a happiness index of almost 100%. Next, please. Yeah. So the American Diabetic Association in 2024 recommendations supports the concept of glycemic happiness. That means apart from the sugar values and the medication management, tailoring the doses of medicine as well as insulin, so the glycemic happiness is given an extremely important attention in these patients. Psychosocial care should be provided to all people with diabetes with the goal of optimizing health related quality of life and health outcomes in these patients. So we have to look at the prevention and management of complications as well as the quality of life, which is extremely important. So such care should be integrated ideally into the routine medical care and delivered by the trained healthcare professionals using collaborative, person-centered. Because every person will have their own requirements, own expectations from the medical team, and then culturally informed approach. So there are various cultures in our country, as we all know. So we need to be kind of broad minded so that the patient's personal life is taken care of. Next, please. Can we have the next? Yeah. So there are four major pillars of glycemic happiness. So I'll re-emphasize it again here. The glycemia is basically a state of raised sugar level in our blood. So having raised sugar, that is diabetes, at the same time being happy. So we need to, there are 4 or 5 people which are there. One is the patient himself. He has to be actively involved. So we need a happy patient, of course, and a happy doctor and happy caregiver as well as happy family who can actually support the person during the management of diabetes, and happy communication between the patient and the treating team. Next, please. So happiness scale is devised for all stakeholders, whether it is patient himself, caregivers, and anybody else, from strongly disagree to strongly agree. That is 1 to 5. Next, please. Yeah, the satisfaction and understanding of diabetes, happiness and satisfaction with the life, flexibility and convenience of the treatment. So we need to modify or tailor our treatment according to the patient's day-to-day schedule. His insulin timings may have to be kept little different. Drug of choice may have to be little different as compared to the from one patient to the another, because you cannot generalize the diabetes treatment in all patients with the same kind of chart. And confidence to handle the complications like low sugar, that is hypoglycemia, as well as the very uncontrolled sugar, that is hyperglycemic episodes in these patients. Next, please. So Caregivers are equally important, including their family and the medical teams. So they all have actually a combined role to play in managing his or her diabetes and keeping the patient psychologically fit, psychologically happy while he or she is being treated for the diabetes. Next, please. Of course, the physicians, nurses taking care of the patient, diabetes counselor, educators, they have an extremely important role to play. They are the people who are going to guide the patient as well as their family and friends how to help the patient at home and in the society in general. Next, please. So we need to strike a smart conversation with the between the physician and the patient, nurse, as well as the diabetes counselor or educator is necessary throughout the course of the disease. It is not a one-day business. It has to be done on every hospital visit of the patient. Has to be continuous diabetes related education to these patients. Smart conversations are especially important when diabetes was first diagnosed. Inappropriate self-care behavior occurs. So कहता है कि साहब I don't want to take drugs at all. So then you need to work extremely harder. Try and explain him, counsel him for the need of the treatment. Conflicts arise between the belief systems and therapies. We know that the ours is a country where there are different beliefs. We won't take insulin. There are multiple additional, kind of alternate therapies which are coming up every day in every system of life. Be it Ayurveda or homeopathy, they claim that they will treat the type 1 diabetes on day one within few weeks. So we need to actually explain to the patient that look, you have a diabetes which where the sugar levels are going to vary, but you cannot probably completely eradicate it except the treatment like pancreatic transplant or so. So insulin therapy, when it becomes necessary, where then the interaction between the treating physician as well as patient becomes extremely important, because many of our patients, we do find that they are quite reluctant. Of course, nobody wants an injection to be given to him. So we need to explain that look, now the status is that we cannot do it without injections. Tablets are not working enough now. And of course, we know that the type 1 diabetes has to be on regular lifelong insulin from day one of the diagnosis. Sorry. So in type 2, though, we can have patients maintained on oral medications for quite some time. But generally beyond 10 to 15 years of the after the diagnosis, we need to add insulin to many of these patients. So the cardiovascular risk is something which is extremely elevated in these patients with diabetes. So diabetes is a major risk factor for developing heart disease. So all these patients should be continuously screened for diabetes, heart and its related complications. Sexual dysfunction, which is often neglected in routine clinics, that we either do not ask as a physician, or the patient also do not come out with the complaints related to the sexual dysfunction, because that is another aspect of life where the psychological satisfaction to the person is extremely important. So we need to pick up all these points and discuss and try and help the patient out. Next, please. So the physician message to the diabetes patient should be that they promote healthy lifestyle. We generally advise them to aim at healthy weight, encourage that means BMI below 23 or so, encourage the meal planning that includes variety of foods, controlled portion sizes of the food, snacks, increase the fibers in our diet, and limit the refined carbohydrate. Try to take more complex carbohydrate. Also reduce the salt as well as fat intake. Include moderate to intense physical activities such as brisk walking in daily or at least on alternate day basis. 45 minutes intense activities are generally prescribed. Support and self-care behaviors, that you need to look at your feet every day, take care of your eyes, oral care, brush, and take care of infection inside the oral cavity. monthly oral self-examination, use of blood glucose monitor. Most of our patients are advised to have glucometers at home these days, so they need to carry them and use it actually. There are people who just have glucometers at home. They say that we are hardly not using, I could not procure these strips and so on. So we must promote the patient to have the self glucose monitoring at home. Use of medication should be, of course, as prescribed by the treating doctor or the treating team. Next, please. So apart from the lifestyle modification, drugs are equally important. So let us look what is this scientifically, this happiness and glucose control association. Next, please. So emotions influence the diabetes health outcomes. There is no doubt about it. So the positive feelings of well-being and resilience while someone is having diabetes help to sustain the long-term coping efforts to manage his or her diabetes, protects it from the negative consequences of prolonged distress, facilitates diabetes self-management behaviors, greater exercise and diet adherence, lowers the HbA1c level, that is our target of less than 7%, reduces the diabetic complications. If we keep the sugars under control, person is less likely to develop complications of diabetes, especially in the initial phase of the diagnosis. Initial 5 to 6 years are extremely important. Please note that because many patients will say that initial 5 years I will try and manage it with kind of lifestyle modification, dietary, lot of desi medications and so on. But please note that initial 5 years are extremely crucial in the life of a diabetic. So please focus there. Try to control the diabetes as much as possible. This will ultimately, apart from preventing complications, will lower the risk of death in these patients related to the diabetes and its complications, especially the cardiovascular deaths. Next, please. Because diabetes is said to be a cardiovascular disease equivalent. Somebody who has diabetes, his or her chances of having heart disease are much more higher as compared to the general population. So the happier individuals may use more adaptive coping mechanisms when faced with daily stressors, resulting in a better basal activity of stress related systems. Next, please. Next, please. Yeah. Next. So don't do the diabetes alone, because it is not only the sugar value which is important. Support to crucial to success. Find a diabetes healthcare team you trust. So patient should go to a trustworthy diabetes care team who can take care of all their queries and problems. Talk to your care team about the things that are getting in the way of your following your treatment. What problems you are actually facing while managing your diabetes. Please talk to your doctor. Please talk to your treating nurse or who is dealing with your diabetes. Talk to the friends and family about how they can help you. Learn as much as you can, because these days we have a lot of approaches, but please do not that means the social media, I would say YouTube and many other things, Facebook and so on. But please do not take a decision on the treatment based on these alone. Please go back and talk to your treating doctor whether I can do this, what better can be done now. I think the time seems to be over. Hello. Yeah, next please. Give up the guilt. You are having diabetes, your life is gone now. No, don't beat yourself up to eat more and more you planned and could not exercise, but try to make it a habit to follow the nutritional activity daily recommendations suggested by your doctor. Taking one, two, or even three medications to manage diabetes doesn't mean that we have failed. And even the adding insulin is not failure of the treatment, that you are having an advanced disease. There are patients whom we would start using insulin little early as compared to those patients who continue it, who started after say 20 25 years of diagnosis. Please overcome the depression and distress. Concerns like sticking to schedule may make you feel overly stressed. If you feel down, talk with your healthcare team about what's bothering you most and what do you want to do about it. Look for warning signs of depression. This can include feeling helpless or hopeless about your life. Please go back to your doctor, he himself, or he may refer you to a psychologist or a psychiatrist. There is no harm in doing that. Schedule fun with your people, like in your people you like in your life. Have fun in your life. हंसी मजाक करिए लोगों के साथ में, जिनको जो आपके दोस्त हैं, बिकॉज फ्रेंड्स आर दी बेस्ट मेडिसिन, वी नो दैट. नेक्स्ट प्लीज. Yeah. To summarize that happiness is an essential component of type 2 diabetes management, especially important determinants of glycemic happiness in persons living with type 2 diabetes are good glycemic control, that is good sugar control, a flexible and convenient treatment regime, which can be designed with the help of your treating doctor and treating team, and level of diabetes education. Please try to learn as much as the diabetes about the diabetes as you can and its management, how to handle a particular situation or a particular complications, and current satisfaction with your life. Try to be happy in your life. If you have any problem, get back to your treating doctor or the treating physician as many times as you want. I think I will end here. Thank you so much for giving this time to me.